Okay, good afternoon, everyone. Welcome to our webinar on strengthening Delaware's health through community health workers. We really appreciate you taking the time to join us for this informational webinar about the role of community health workers in Delaware and why the program and the individuals who support its success are so important. Next slide. My name is Erin Rideout, and I'm on the Coordinating Council for the Community Health Worker Association of Delaware. I'm also a manager with Christiana Care in our Community Health Impact Department, and I'm joined today by Christy Handley, who I'll let introduce herself.
Good afternoon. I'm Christy Hanley. I'm a senior consultant with PMG Consulting, and I'm also a project director for workforce development and all things CHW with the Sussex County Health Coalition.
Yes, and a very active member of our CHW Association's Advocacy Committee as well. So thank you all again for joining us. We look forward to guiding you through today's discussion. We encourage you to explore the resources link in this webinar. Check out the Community Health Workers Association of Delaware website afterwards for more information and helpful resources. We've also included our contact information, so please feel free to reach out if you have any questions or if you'd like to engage in further conversation about the role of community health workers and how they can support your organization's mission and work. Next slide. Here's an outline of what we'll be discussing today. This webinar is really designed to help give you, as an employer in Delaware, insight into how valuable employing community health workers is for you, your team, and your organizational success. If by the end of this webinar you have someone in mind who would be great for the role, we encourage you to provide them with the information we're sharing with you today on how they can get involved. We'll kick off today's presentation with some information about the Community Health Workers Association of Delaware, who really supports a lot of the work here in the state. Next slide. The Community Health Workers Association of Delaware was developed in 2019. That's when it got launched by community health workers for community health workers and really with the community in mind. Collectively, membership in this association represents over 35 diverse organizations, agencies, and sectors statewide, and our coordinating council has a combined experience of over 21 years in supporting our neighbors and communities and helping them reach their full health and well-being potential. Our mission is to collectively advocate, empower, educate, connect, and support the communities in Delaware to ensure health equity, social justice, and optimal well-being. Community health workers, or CHWs, are really passionate about the physical, social, and emotional health and well-being of everyone in our state. CHWs drive change through advocacy, resources, and training committees, and the association is here to support those doing the work. The Community Health Workers Association of Delaware supports workforce development, standardized training, and integration into care teams. We know CHWs can make the biggest impact when they're really embedded and integrated into the teams that you are using to support those you serve. And so we're really encouraging employers to take on integration of CHWs into their teams and really supporting individuals in becoming CHWs here in Delaware. When you encourage and integrate and support CHWs into your teams, you're better positioning your organization to provide and maximize care for the patients and the community members that you're serving. The association has free monthly trainings or webinars that are focused on the core competencies or skills of community health workers. And these trainings really allow individuals to have the opportunity to connect and collaborate with other CHWs throughout the state, which better allows them to make kind of key resource connections when they're working with their clients. We also, as an association, host an annual summit, really serving as an additional opportunity for training and networking for the CHWs that you employ. And finally, through our advocacy initiatives, we're promoting sustainable funding of community health workers, which also benefits our employers here in the state of Delaware, trying to supplement the grant funding or other funding that you use to support CHWs on your teams by striving to gain reimbursement in the state.
Thank you, Erin, for providing all of that wonderful information. And I get the honor of providing some information on what the role of a CHW truly is here in Delaware. So I like to start this off by really letting you know what the role is and why it's so important. So our CHWs are those trusted liaisons out in our communities to help navigate those healthcare and social services. They are that bridge that brings together those gaps between the residents and the resources that they need to stay healthy. They are trusted neighbors because they truly understand what that local culture looks like because they generally are from those neighborhoods and those surrounding communities, and they're able to provide those resources based on what those communities' specific needs are, which allows community members to feel even more heard and understood and supported in the system that they are working in. So they make sure that every Delawarean that they are touching feels supported and has the support system that they need to thrive in the community for which they live. And our CHWs are across many different settings in the state of Delaware. That includes our hospital systems, our federally qualified health centers, the Division of Public Health, any community organization that you could think of, and many of our managed care organizations. Next slide. This slide talks about the core roles and skills of what our community health workers look like. So they engage in a lot of outreach and education, coaching and social support, care coordination, and advocacy. These are all really great skill sets for the individuals who are currently supporting Delaware community members through any of the organizations. This slide completely outlines what the association recognizes as core roles and skills for CHWs, and I can go through a few of those. CHW core roles look like mediation, cultural mediation among individuals, health and social service systems, care coordination, advocating, coaching, support, those kinds of things. But the core skills are their communication skills, their interpersonal and relationship building skills, service coordination and navigation skills, education and facilitation skills, advocacy, building individual and community capacity, individual and community assessments, outreach, professional skills and conduct, evaluation and research, and knowledge base. And when I talk about these skills, I want you to understand that our CHWs, while they are working with individuals to help support them, that's the key word, support them in navigating these systems, the ultimate goal is to allow them or empower them to do it themselves. Next slide.
Thanks, Christy. The current CHWs in Delaware have really helped provide the Delawareans they've supported with resources and a better understanding of the health and wellness landscape in the state. Through this work, we can proudly say that there have been improvements in preventive care, reduction in hospital readmission rates, and improved patient engagement and self-management skills. And so when you're thinking about that increase in prevention, right, we know the more preventative care that somebody gets, often the less acute care or emergent care that they need. And so CHWs who are based both in the community and within health systems are encouraging patients to schedule preventive care. They're helping them with that scheduling. Sometimes it's really hard to navigate our healthcare system, helping them with transportation barriers to get to those appointments, right? So really doing a lot of that kind of care coordination, case management support that people need initially to be successful in getting connected to their healthcare system. Some people don't come into your programs with primary care homes, right? And so CHWs can play a key role in making that connection. And when it comes to hospital readmission, CHWs can really support individuals in understanding kind of what the doctor said to do when they got discharged, right? What do they need to do? What follow-up appointments do they need to make and attend? And again, how can we reduce those barriers that people face in attending any kind of follow-up care or appointments? When we think about patient engagement and self-management skills, CHWs throughout the state are skilled in a lot of different areas, including chronic care management. And so you've got CHWs who specialize in diabetes, CHWs who specialize in cardiovascular health, right? So being able to really support patients as they manage their own condition, and like Christy said, really empowering them or affirming them to be active in that role that they've got in their own health health. Um, CHWs that are based in community-based organizations do these same things, even if they're not directly connected to the healthcare system, right? They're asking patients, okay, what do you need? How can I get you into healthcare? How can I help you manage that? Next slide. And it's through this impact that we know that CHWs are really cost effective, right? That's that ROI, that return on investment. For every dollar invested in community health worker programs, there's a proven return on investment that ranges from $1.80 to $2.47. And this is through that integration of CHWs into healthcare teams, into community-based teams that may not always be focused on health. You might be really focused on social drivers, but the CHW can join your team or participate in that work by really bridging that gap between the community and the healthcare system, also reducing ED visits. Next.
Great, thanks, Erin. I'm going to talk to you a little bit about the benefits of what it looks like to employ one of our community health workers or a community health worker that's out in our communities. Next slide. So there's so many benefits of having a community health worker within your own organization. Not only is it a benefit for you to have a community health worker within your organization that maybe could assist those within your organization, but there are so many other benefits as well. And you can see those up on the screen. We have noted that there's improved patient engagement and satisfaction because what happens is this community health worker is directly engaging with the patient or the client, and they're able to reach out and talk about those social determinants of health needs. And they can get those met while they're also working towards their healthy lifestyle or their medical needs. We also see decreased avoidable emergency visits and readmissions. I know this in particular because we have one hospital system that has a community health worker that's placed in an emergency department. They saw one of the individuals go from 19 visits in a month, or no, 60 days, to 0 visits the next month once the community health worker got engaged with the work that they were doing. We also see the increased quality scores and value-based payment outcomes and the enhanced trust and reputation. And when I talk about the trust and reputation, like I said before, our community health workers generally are coming from these communities, so they have the trust of the individuals that are living in those communities to ensure that they are able to get the support that they need. I will also let you know that if you're a medical organization, our CHWs complement your care team. They save providers time that they don't have to address those social determinants of health. Next slide. So I'm going to read off a few of the quotes that we received regarding what a community health worker has done for some of these organizations. We all know who the Delaware Breast Cancer Coalition is, and their community health worker has been pivotal in removing barriers that have allowed men and women to prioritize their own health, whether through screening and self-advocacy skills or by enabling them to remain supported and treatment compliant after diagnosis. This crucial support is directly making a difference in the outcomes of patients, as it enables them to focus more on healing and less on external obstacles. By mitigating these barriers, the CHW is not just improving individual health, but it is also contributing to the stability needed to keep families whole and communities unbroken. And we are thankful for our CHW and the additional support this role provides to our communities. Lorette Health Center states that their community health workers are irreplaceable members of their team. Through community level case management and transportation, they provide connection, insight, and ongoing patient support that they simply cannot achieve in a 15 to 30-minute visit. They help patients get to appointments at Lorette and with specialists across the state, understand what's happening in their lives outside the exam room, and they stay engaged in their care. Because they meet patients where they are and build real trust, again, there's that trust word, our CHWs make our care and programs stronger, more effective, and more responsive every day. Christiana Care says the implementation of the CHW team in our healthcare spaces has been nothing short of transformative. A clinic visit can address blood pressure, but it cannot fix a lack of nutritious food or an inability to afford medications. The CHWs tackle these fundamental social determinants of health head on. They connect patients with vital community resources, help them navigate complex systems to secure housing assistance, and enroll in benefit programs or find reliable transportation to appointments. This holistic support ensures the clinical advice we provide is actionable in the patient's real life. These are not just caregivers, they are trusted members of the community, again, trust, that they serve, cultural backgrounds, linguistic competencies, and life experiences with our patient population. And Child Inc. says that Child Inc. employs specialized community health workers who serve victims of domestic violence. Some victims, due to the control the offender has over them, and other victims with transportation issues cannot travel to meet in an office setting. Our domestic violence community health workers meet their clients in the community wherever they feel safe and comfortable. When a referral call from a hospital or other Medicare medical provider is received, the DVCHWs respond to that location to engage the victims immediately in services, which is much more effective than a medical provider simply giving a victim a phone number to call for help. The DVCHWs are responsive to the health and safety needs of victims in the community and are a vital part of Child Inc.'s complement of services provided to victims of domestic violence and their children.
Thanks for sharing those examples, Christy. I love how it's from so many different organizations, right? Like, so you've got a major hospital system, you've got a federally qualified health clinic, you've got the Breast Cancer Coalition, right? You've got a smaller community-based organization that focuses on domestic violence, right? And so hopefully as an employer on this call today, right, you can see the real range of where CHWs might fit within your own teams. There's a lot of opportunity to connect those dots and build that trust. And really engage people from the communities that you're serving in that work. So thank you for sharing those. We're going to shift a little bit to talk about certification and how to really integrate CHWs into your workforce. There are a few different ways that people can become CHWs, and now they can gain certification. Certification for CHWs launched on January 1st, and so we're really excited to share this new information with you. So certification for CHWs in Delaware is voluntary, and there's great value in this voluntary certification. Certification not only defines the scope and the standards for CHWs in Delaware, but it also ensures that CHWs focus on non-clinical social drivers of health, and future efforts in our certification can really specialize. So thinking about the general certification for CHWs in the future, we might have specific modules that focus on things like trauma-informed care or opioid awareness and prevention, health literacy, community violence intervention, right? So things that really can help advance population health as part of the curriculum or the recertification requirements. We believe that the standardization that certification provides better positions CHWs in Delaware to reach their full potential as a workforce. And there are two pathways to certification for CHWs in Delaware. There's a standard pathway and a legacy pathway. And for both pathways, individuals must be 18 years old or more, live or work in the state of Delaware, and confirm their commitment to adhering to the CHW Code of Ethics. Next slide. So for the standard pathway, this requires the completion of a CHW core skills training from one of our approved training providers. Currently, this includes the Delaware Division of Public Health, the Penn Impact Model, PHMC's CHW core training, and Delaware Technical Community College's CHW certificate program. The legacy pathway requires verification that an individual has completed a minimum of 2,000 hours of paid or volunteer work as a CHW in the last 5 years. And this pathway will remain open through June of 2027. It's an initial pathway only open during the first 18 months of certification. And this allows CHWs who maybe haven't completed a core skills training but have been active as a CHW to be able to become certified. For the legacy pathway, the employer of the individual will attest to the CHW applicant's time and hours worked, and the employee will submit in their application their employer's name and address, their supervisor's name, contact information, and then the employer gets an email where they can verify that work as part of the application process. Certification for CHWs lasts for 2 years, and then CHWs would apply for recertification. The requirements for recertification, including submitting proof of 30 hours of continuing education, two of which must be in ethics. And so that's over the course of the 2 years. They have 2 years to kind of make sure that they're staying up to date on current CHW core skills educational opportunities. Next slide. Certification really allows CHWs to develop standardized skills and competencies, achieve professional recognition and workforce quality, and contribute to easier onboarding, supervision, and reporting structures across the sectors that work with CHWs. So this benefits the CHWs, but it also benefits the employers because when you have somebody who's a certified CHW and they're applying for a role, you can be certain that they've achieved a certain level of training, that they are, bound by a code of ethics, and that they have a certain level of quality that they're bringing to your team. The Community Health Worker Association of Delaware, the Division of Public Health, PHMC, Delaware Technical Community College, all of these, the association and the training providers have really collaborated to ensure that certification aligns with national standards. The association also gets support through the Academy, who is part of our reviewal process for training curriculums to ensure that the curriculums themselves align with nationally recognized core competencies through the C3 Council. Certification is really critical also on our road to reimbursement, as Medicaid reimbursement will be tied to a CHW certification status. So if you've got CHWs that are part of your team and you've got your eye on the future of Medicaid reimbursement, you'll want to make sure that those CHWs are certified CHWs, and we can provide a lot of support around that moving forward. Christy?
Thanks, Erin. As you can see, there are lots of benefits of having your community health workers certified through the CHW Association. And part of that, and if we can go to the next slide, is what Erin was talking about when we're building sustainability in not just the CHW landscape, but also in our programs. Next slide. So in addition to the benefits of the certification, I wanted to bring up that apprenticeships here in the state of Delaware are a way that we can provide employers with a very structured, cost-effective way to develop a highly skilled certified workforce that is especially trained to meet your organization's unique needs and community culture. The apprenticeship program was designed by the Sussex County Health Coalition back in 2022 and was approved in May of 2023. We also note that another pathway to sustainability is the Medicaid reimbursement and managed care contracts, which Erin talked about a little bit briefly. And then because currently the way that that CHWs are funded in the state of Delaware is largely through one-time or very time-limited grants that provide financial support to organizations. And the problem with that model is that it creates challenges in consistent funding and program planning for community health workers. You may have a community health worker that works for an organization is showing wonderful return on investment for the organization and the community as a whole. However, the funding runs out and then that community health worker no longer has a position. So we're really looking to sustain those positions in the state. And to show Delaware's commitment to health equity, funding for the CHW should be supported through our state Medicaid system, health plan coverages, and funding for the Community Health Worker Association of Delaware. And as Aaron did say, we are exploring reimbursement and policy models to sustain those roles in Delaware. Next slide. So, what are we here for? What is it we're asking you for? What are those next steps? If we can go to the next slide, we can talk about them a little bit. So, really, let's take a look at your organization and see where a CHW could strengthen your care delivery or your outcomes. What does that look like for your organization? Are you a medical provider that needs a community health worker to come in and be integrated into your team to take some of that heaviness off of your care team and take those social determinants of health and put them somewhere else? I think that's a wonderful avenue for many of you to choose. I also think our community based organizations can really utilize our CHWs out in the landscape as well. Another way is that you can partner with the Community Health Worker Association of Delaware for workforce development and certification. Really help us advocate for that reimbursement model when we talk to our legislators. And then I would say support your CHW staff with professional development and fair compensation. We do know that some of our CHWs are barely making minimum wage, and the work that they do is very valuable out in our communities. And we just ask that you provide them with that fair compensation model within your organizations. And then also look towards maybe an apprenticeship if it's something you want to try out. You know, you're not really sure how this is going to work for you. Connect with us on how you can bring an apprentice into your organization, build them with the skills that you need them to have, and then put them to work in your communities.
And so a lot of those resources that Christy just mentioned and that we've mentioned throughout this webinar are located in the resources button of this webinar. So like Christy just mentioned, apprenticeships, if you click on resources, there's a link that you can learn more about that. We also have the links to different training providers in the state. Certainly the association is on there. Christie's work with the Sussex County Health Coalition. So Sussex County Health Coalition is on that resource list. So definitely check out those links. It's going to have a lot of important follow-up information. And our contact information is listed here. Please reach out if you have any questions about the role of CHWs in Delaware, how CHWs might fit into your organization or your initiatives, the work that you're doing. But thank you. We want to thank you for watching this webinar. We hope that you feel encouraged to incorporate CHWs into your organization, into your teams, and hopefully maybe you've thought of a few employees who would be a great fit for this role. We do have time for Q&A, and so if you are able to click on the Q&A button, you can put your questions in there. I think we have a few already, so we can respond to the questions that are in there, but please add some more, and we will go through them one at a time. So the first question I see is if a community health worker completes a CHW training, are they certified? So they're not automatically certified, but they're eligible to be certified. So folks that have completed the CHW core skills training through DPH's in-person training, through PHMC's virtual CHW core training, through the Penn Impact Model training, and then who have completed Delaware Tech's CHW certificate program. So if they have their certificate, they've completed a training with one of those four training providers, they can apply for certification through that standard pathway that we talked about. It's relatively straightforward and easy. To date, we have over 150 certified CHWs, and the vast majority have gone through that standard pathway. So the majority have been trained through one of those approved CHW core skills trainings. And we'll keep that list updated. We've already gotten an application from another provider who is interested in being an approved provider. So that list will grow. But for right now, if they have a certificate from a training, they still need to apply through our website to become a certified CHW. Okay, next question. Are CHW services eligible for reimbursement? Not yet. So Delaware is a little bit behind when you look at other states. There are about 24 states who reimburse through Medicaid for CHW services. So although we're the first state, we're going to try to at least be 25th in that regard. So we'll have a lot of advocacy opportunities that we would love employers to join in on. We've got kind of our advocacy allies mentioned on our website. If you're not on there and you want to be, please sign on to our letter of support. We'll be doing a lot of advocacy this legislative session. Um, the most recent kind of progress we've made in this regard is last session, Senate Joint Resolution 2 was passed, and it tasked the Division of Medicaid to generate a report for the legislators to review on what CHW reimbursement could look like here in Delaware. And so that report was submitted in January, and the next step is some advocacy efforts and hoping that that the legislators will submit another piece of legislation to mandate the implementation of that, right, to launch the Medicaid reimbursement. We just got a date for an advocacy day. So if you're interested in your CHWs being reimbursable or your future CHWs being reimbursable, you can join us when we go down to Legislative Hall on April 15th. And there'll be more information to come through our association channels on that. And then let's see. I work at a community agency. How can CHW support our work? So Christy mentioned a little bit about this during the webinar, that CHWs, right, aren't just for healthcare systems, right? They're not just for health clinics. There's a lot of amazing work going on throughout Delaware in community-based agencies that involve CHWs. We saw the example from the Delaware Breast Cancer Coalition and from Child Inc. on how they're supporting victims and survivors of domestic violence. We know that there are CHWs in like the Latin American Community Center, right? The Hispanic American Association of Delaware. So a lot of community-based organizations utilize CHWs. We know that the majority of health happens in the community, right? Most of our health outcomes are really taking place in the community, not necessarily in that direct clinical space, right? And so if 80% of our health is determined by what's going on outside of the walls of a hospital, certainly we want CHWs in that space. Um, so I think if you work for a specific agency and you're like, oh, I love this, but I don't know where they would fit, email us. We're happy to hop on a call, kind of talk it through with you, hear about what your work is, and kind of help brainstorm with you where a CHW might be able to make the biggest impact in the important work that you're already doing. Christy, would you want to add anything to any of those answers?
No, I think you hit a lot of it right at the nail on the head for most of that. And, just to add to what Aaron was saying about a CHW in your community agency, we've seen several community health workers across the spectrum, like we were talking about earlier, and the impact for each of those organizations is different. And it's just really based on what those communities' needs are. Down in Sussex County, it looks a lot different than it does up in Newcastle, and Kent may look different than Sussex. So, what we want to make sure is that the community health workers that are out in the community with these CBOs we're making sure that they meet the needs of that community specific. Because, like I said, Newcastle and Sussex are totally different, and the needs are going to be different. So we just want to make sure that the needs are met across that entire landscape, which is why we would love to have more community health workers in our community-based organizations.
Thanks, Christy. I'm not seeing other questions. I know we still have folks with us, so thanks for hanging with us through this webinar. Do you have any other questions or comments?
We have a quiet bunch today.
I know.
Oh, there's a question
Okay.
about that.
Yeah. Are there any training resources for new employers hiring a CHW? So there's not a formal kind of training resource other than the association is certainly a resource. The Sussex County Health Coalition is a resource to talking with specific employers around kind of how to best hire a CHW, again, how CHWs can best fit in your organization. So it's more of a kind of a technical assistance support than it is a training resource. But we are looking into specific training opportunities, offering more webinars like this one to CHW employers specifically or potential employers. Um, so hopefully there'll be some more coming down the line, but for right now it's an email and ask and we will get you those kinds of resources. Christy, what would you add to that?
I would add that if you're looking at bringing someone on and you want to do it as an apprenticeship type model, then we definitely can support you. Sussex County Health Coalition makes sure that we support all of the employers that come through, as well as their CHWs. So we have staff that make sure that you felt very supported. You have the resources that you need to make this a successful employment endeavor. And I would just make sure that people really understand that there is support out there. There is, because we want it successful. This is important to all of us. It's our community's needs. We need to meet them, and we want to make sure this is successful.
Thank you for that question. Any other questions? Okay. So I would just encourage you again, click on those resources, open up those links so that you can access them. Make sure you jotted down our contact information. Um, which is just hello@chwadelaware.org. But please don't hesitate to reach out. We are here, like Christy said, we are here to support you all. We believe that CHWs can make an invaluable impact on the work that you're doing. Um, and are here to kind of answer any other questions that you might have. And the website is there on this last slide. It has a lot of really great information and resources. It offers more information around the certification that we talked about. So it's a great place to send people to. And if you're not already a member of the association, you can join it by clicking on that link. And by joining the association, which you can do as an ally, you do not have to be a CHW to be a member of the association. You'll gain access to the invitations for our monthly meetings where we talk about really important updates and opportunities. We share resources with those who attend those meetings, but also our email listserv, which also sends out a lot of really important information and updates to keep folks in the loop. Again, both CHWs and the organizations that employ our amazing CHWs. So click on that link, join the association, and keep in touch. Thank you all so much for joining us today.
Thank you all.